My name is Sanjay Gupta. I'm a cardiologist, and today's video is entitled The Death of Common Sense Medicine. So medicine used to be about looking at the person in front of you and asking, what makes sense for this human being? Now, too often, it's about looking at the guidelines and asking, what is the safest thing for me? Let me give you an example I see all the time. A patient comes in, exhausted, hair falling out, brain fog, muscle weakness. We do the blood test, and sure enough, their level of a key vitamin, mineral, or hormone is right at the bottom edge of normal. Not below it, not technically abnormal, just scraping along the floor of the reference range. And you know what happens next? Nothing. Because the protocol says we only treat if it's below the reference range, even if the patient is suffering, even if correcting it might help. The box isn't ticked, so the door stays shut. Why is this a problem? Well, reference ranges are not magical boundaries between health and disease. They are statistical constructs, a range where 95% of the population sits. That means 1 in 20 perfectly healthy people will fall outside that range, and plenty of unwell people will still be inside it. Your body doesn't care if you are technically within normal limits. If your personal baseline is higher, then being at the lower end might still leave you symptomatic. This is where common sense used to come in. A doctor could say, all right, you are low normal. You've got all the symptoms. Let's correct it carefully and see if you feel better. That was patient-centered care. That was medicine as an art, not just a science. But now, many are scared. Scared of stepping outside the tick box. Scared of complaints. Scared of taking responsibility for a decision that isn't printed in black and white. And this loss of common sense comes at a cost. When we stick blindly to the cutoff, we leave people untreated, sometimes for years. They get sent from clinic to clinic, told their blood tests are fine, even whilst they feel awful. And this drives a wedge between doctors and patients, because the patient hears fine and thinks they're not listening. Common sense in medicine isn't about ignoring evidence. It's about applying it to the person in front of you. Guidelines are a compass, not a prison cell. One of my viewers very beautifully put it, that guidelines are meant to be handrails, designed to guide, not handcuffs meant to restrain. If the patient's symptoms and their biochemistry tell the same story, you should treat the patient, not just the protocol. The death of common sense in medicine isn't inevitable, but it will happen if we forget that patients are people, not just numbers on a page. And sometimes the most important thing you can do as a doctor is to listen to the person, not the range. I'd love to hear your thoughts. All the best.